Well, good afternoon, and thank you for joining us for today's Manulife Business Success Series webinar on operating your business during COVID-19. My name is Ian McLean. I'm the President and CEO of the Greater Kitchener-Waterloo Chamber of Commerce. Before we get started, I'd like to take a moment to acknowledge that we do live and work on the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples, as we seek a renewed relationship based on a foundation of mutual understanding and respect. Today's session would not be possible without the continued support of our sponsors and partners. And so a special thank you to our title sponsor for the Business Success Series, Manulife. Our platinum sponsor for the series is the Immigration Partnership of Waterloo Region, and to this month's presenting sponsor, Learners LLP. These organizations are committed to supporting our local economy and providing businesses with the resources and tools they need to thrive. Just before the session starts, I'd like to go over a couple of quick reminders. Please ensure that your microphone is muted throughout the presentation so we can reduce background noise. If you have any questions that come up through the sessions, you can type them into the question box in your control panel at any time. If they're tech related, a representative of our team will get back to you right away. If you have questions for for any of the presenters today, they'll be gathered throughout the session, and our speaker will do their best to answer those questions. All attendees will be sent a recording of today's presentation and also be made available through the Greater Kitchener Chamber website. I'd like to now invite Graham Bennett, partner with Learners LLP, to introduce today's speakers and bring some remarks. Sorry, go ahead, Graham.
Hey, thanks, Ian. Learners LLP is really proud to be this month's presenting sponsor of your Business Success Series. And I'm really pleased to remind everyone that Learners has opened an office in Waterloo Region, located in downtown Kitchener, right next to the Chamber, in fact. I work out of the Kitchener office, and my practice for almost 30 years now has focused on insurance and personal injury litigation. The Learners firm itself has been in existence for almost 100 years and has grown to become one of Ontario's largest law firms, now with offices in London, Toronto, Strathroy, Owen Sound, and now here in Waterloo Region. The firm has over 120 lawyers experienced in litigation, insurance law, corporate and commercial law, including wills and estates and real estate law, health law, family law, privacy law, and class action litigation. If anyone has any questions or is looking for a referral to a specific lawyer, please don't hesitate, reach out to me or go to our firm website at learners.ca. And I understand that you and Greg, Ian, are going to be presenting today, and I wish you a great webinar today. Thanks so much.
Thanks so much, Graham. We do appreciate your learners and your support for this important series and for helping us out this month. Let me just introduce, and I won't go formal introductions. I'll be nicer to Allison because Allison is the smartest part of this panel of people that are on today. Allison Mitchell works at the chamber, my chamber, and she is the manager for the Student Access Talent Program, which is connecting small business with opportunities for students to come in and do everything from research projects, short-term, everything short of co-op actually. And so keep that in mind as you start to come out of COVID and are looking for some help. The great opportunity with Conestoga College, University of Waterloo, and Laurier to connect your business with free or low-cost opportunities to connect with students, and it's a great resource for small business. So Allison is joining us because one of the things that, as many people, and Greg will tell you in his office as well, during COVID, many of us are doing double duty, and Allison is no exception to that. She's been working very closely with Lisa at Greg's shop as well on a lot of our COVID programs and projects, and we'll dive into those in just a minute, but wanted to welcome Allison to the show and for bringing some semblance of intelligence to this conversation with Greg. And without further ado, and I'll be somewhat nice, my good friend and colleague, Greg Deroser, is the president and CEO of the Cambridge Chamber of Commerce. He's got a strong background in business, having been in the insurance business. Was a city councilor in Cambridge for, 10 years, Greg, for a long period of time, and has been president of the Cambridge Chamber of Commerce for 20 years. I thought it was 15. Geez, it just seems like forever you've been there. for 20 years, and we have a very strong partnership between our two chambers, and it grows with every passing day. And I think COVID has really cemented the responsibility we feel to work together for all of the businesses across the region of Waterloo. Some of you may know he's my co-host of our radio show that we do weekly on 570 News called Business to Business. So there's your introduction. Wanted to dive right in, and maybe the place to start with you. I'll start with you, Greg. Is really talk about that partnership and how we've developed the platform where we're putting a lot of these programs that are available to not only our members of both chambers, but to any business across the community. And then I'll come to Allison to start to walk through some of the specific programs we have in the chamber. But why don't you walk us through the platform and how we developed that?
You know, I think what's really fascinating about it is we've always had a cordial and good relationship between our two chambers, and but you know, nothing like a pandemic will bring you all together, because nobody wants to be alone to walk through the swamp. You want to be able to hang on to somebody else's arm to navigate some of the challenges going forward. But I think, you know, what's really been, I think, impressive from my perspective is, Ian, you and I we just celebrated 10 years of doing our business to business show. So you and I are, you know, we see each other, you know, even before the pandemic, we saw each other a couple of times a week, whether it was in person or whether it was on the phone, or certainly when we do our show. But I think what has been really important is our staff getting together, and Lisa from my office and Allison have really been the dynamic duo in the region that has, you know, really done the heavy lifting. You and I are really good at this, talking, and they're really good at doing, and you know, and that's what makes a good team. And I think, you know, what we've really established, the relationship that we've established, is recognizing each other's important factors in serving the business community, bringing those together. And I think, you know, well, we've had accolades from other chambers, from senior chamber management like Perrin Beatty and Rocco Rossi, at almost marveling at what our two chambers have been able to do through this pandemic together, and how important our work has been. And certainly, you know, like I said, you and I take credit for the verbiage, and Allison and Lisa and the rest of our teams take certainly all the credit for making it happen. So, you know, kudos to them. But I think our relationship strengthening through this is going to be the most important thing for businesses going forward as we emerge out of this pandemic as well.
So I'm going to come back and we'll dig into the detail, because there's probably 4 or 5 things we want to talk about, what being rapid screening tests, test kits, the masks that are available through Eclipse, and we'll talk about that. We've got our Chambercheck Chamber Business Ready certification or training program. And then we've got government support and federal and provincial government cash flow support programs. But we wrap that all inside one platform, Allison, and I think it was you and Lisa came together and said, how are we going to do this so we don't have to direct people to the Greater KW Chamber website or the Cambridge? We wanted to make it simple. So you guys came up with developing a website called Chambercheck.ca. So maybe talk about the formulation of that, of why we did that. And then we can dig into the details, which I think a lot of people listening in will want to know about the specifics in there. But I think it's important to understand the platform itself, because I think with every passing day we've added, it started with one thing, which was our training with N95 and called Chamber Business Ready, and it now has 5 things in it, and it's growing with every day. So that's where we want people to go for those resources. Tell us about the formulation of the platform.
So thanks for having me. We really started, I guess the formulation of the platform goes way back to Chamber Business Ready. So when the two chambers got together with N95 last June to launch Chamber Business Ready, it was really in order to provide businesses with the information and the resources that they needed to operate safely. And so back in June 2020, that's when we were coming out of the first wave of the pandemic. And so we wanted businesses to have one place that they could go to safely get some best practices as they were reopening so that they could hopefully stay open at that point. And so we ran Chamber Business Ready for a period of time. And then in December, actually it was more like the fall, it launched in December, we launched Chambercheck. And so chambercheck.ca or Chambercheck, the training has really come out of the Chamber Business Ready platform. We worked our two chambers along with Exonify and the Region of Waterloo Public Health to develop this training. It's for business owner operators and for employees. And it's a certification training. And that's really when we launched the chambercheck.ca website, and from there we've been adding to it. So then we added Ask the Expert, and then we added the rapid screening, and we've recently added the masks, and we have a summary of the government funding support programs that are there. So, you know, we keep adding these elements, these resources to businesses that are all free and they're available to any business that are there, because we really just want them to have the resources to operate safely.
Well, maybe let's dig in while we're on the topic of the Chamber Business Ready, and then we'll come back to the other ones, because that's really where it all started. Again, this is a story that Greg will talk about when we talk about the rapid screening, is partnerships, right? Exonify reached out to us and said, hey, you know, do you want to do some training? And Exonify, for those, maybe you can explain what Exonify does, but this particular one is all online. You know, look at videos and get the information. Do, you know, I call it tests, but sort of a test to reflect that you've actually watched the videos, and so certified both for yourself and your staff. But it's an online version where you can do in a short period of time to give yourself confidence that you're doing all the right safety things inside your workplace. Talk about that program.
Yeah, so the Chambercheck training is on the Exonify platform. Exonify is a local tech company. It's a great company that basically provides this platform. It's training videos followed by a short quiz. And the videos are very short, 1.5 to 3 minutes, and then a quiz. And it's meant to provide people with the information that they need on a variety of different topics. But then the Exonify platform really encourages you to go back on a daily basis. And so there's 5 questions on a particular topic that really reinforces the training that you've had. With the Chambercheck training, we do have 2 training paths. So we have the business owner operator path and we have the employee path. The business owner operators that complete the training will get a certificate and a decal that they can display in their business that lets their employees and their customers know that they've received the training in order to operate safely. The training is 45 to about 60 minutes, depending on the person, and you can do it in one sitting or you can come back and do it in multiple sittings. And it's really training around, you know, proper hand washing techniques and how to properly put on and take off gloves and masks, and how to deal with difficult customers, and proper physical distancing best practices, proper cleaning protocols. It's all these different topics that are important in order to operate a business safely. And so it's a really quick process. It's free, like I said. Any number of employees can take it. So we really encourage the business owner operator to complete the training in order to get the certificate and the decal. And then any number of their employees, we encourage all of their employees to take the training at any point.
Yeah, maybe, Greg, I think that's one of the things here. And again, talk about disruption, and you talked about it at the upset. Nothing like a pandemic to sort of get us thinking outside of our own way of doing things. Everything that's in this Chambercheck platform that Lisa and Allison have remarkably put together and grown, it's all free. And it's all available not only to chamber members, and there's value in your chamber membership, but we're making this available to every business because we're all in this together. So maybe let's talk about 2 other really important free things that are available. And the latest one, and people watching this may have been aware and seen on the media or social media around the rapid screening pilot, that to give credit where credit's due, we talked about it, but you and Lisa have done a lot of the heavy lifting of actually standing this up in cooperation with Allison and myself and our team. But talk about this rapid screening pilot and how to access it and why it's important.
Well, I think it's really interesting. You know, Ian, you and I and our colleague Tony Lamantia, and even Ian Klukman from Communitech, we've been really calling on the government to provide a rapid screening for the workplace at least. We prefer it to be mass rapid screening, but so that we can identify, because we heard right in the very beginning that this virus is a little bit sneaky. It can hide in places and be asymptomatic. In fact, I just learned this morning after a conversation with Health Canada that 1/3 of people who get COVID-19 will be asymptomatic, and 55% of all the transmissions are transmitted from an asymptomatic carrier. So think about that. Half of all the cases that we have were contracted from an individual that was asymptomatic. So if you could find the asymptomatic people, we could have prevented 55% of all the infections out there. So we have been passionate about this, saying right in the very onset, we need to have rapid screening. We need to have the ability to be able to test people and find this little sneaky guy that's hiding around in bodies everywhere that isn't evident. However, the government listened to us, because the government went out and actually procured millions and millions and millions of these tests, but had absolutely no idea how to get them out and utilize them. And so they've been sitting in warehouses, not all of them for that period of time, but sitting in warehouses, and the government sitting, scratching their head, figuring out what should they do. So they contacted Ian Klukman from Communitech, because he was really passionate about this. And actually he was appointed to a position to direct or guide the government in getting these out to the public. So we started meetings, I don't know, about 6 or 8 weeks ago with the federal government. It was Ian Klukman, Ian McLean, Greg Deroser, talking, and federal government officials talking about how we could do this. And of course, we're chamber folks. You know, Ian and I like to talk, but our staff, like Allison and Lisa, are sitting in the background, you know, clawing their way to try and get something done. And we're just not used to the way government works, which is certainly not at the speed of business. And, you know, we came up with some ideas on, you know, bricks and mortar type of places where employees could go. And then it kind of dawned on me, because the provincial government in Ontario said, you can self-screen. You can use these and you do the screening yourself. You don't need a nurse or a healthcare professional. And so we said to the federal government, look, why don't we just give them to businesses and let businesses do it in their employees right there at the workplace. They come in for a shift, you can screen your employees, and then you know who should come in and who shouldn't come in. And while the federal government just kind of fell in love with that idea, but still didn't understand quite how it was going to work. But I think the funniest story about all of this is because we just handed out, we're going to hit the 50,000 kit mark in 4.5 days of our first 4.5 days. We're probably estimating, Allison and I were speaking about it before, we're probably looking at, once we hit our peak, we'll be up to, you know, probably 60 to 80,000 kits a week being distributed throughout the business community in the region of Waterloo. And that means maybe 80,000 employees are being screened as to whether or not they're asymptomatic carriers. But the funniest story of all was last Tuesday, not yesterday, but a week ago yesterday, Ian and I decided we were going to publicly launch this distribution direct to the workplace program. We had everything set up here. We had a little supply of kits. And so our teams get together, and what should we do? Oh, let's have Ian and Greg on Facebook Live actually screen themselves right there. You know, big press conference, CTV was out here, you know, media gathering information and ready to promote this. And what Ian and I did not know a week ago yesterday at 4:30 in the afternoon while we were preparing to go on Facebook Live was that someone from another organization was on the phone with some federal or provincial government bureaucrat that said, no, we can't go ahead with this program. It can't happen. There's too many complexities here. You know, we haven't got all the T's crossed and all the I's dotted. And at that very moment, while they were talking to that government official, they looked on their phone and saw Facebook Live come up with Ian and Greg sticking a nasal swab up their nose publicly and saying, you can come here and get your kits to screen your employees in your workplace. And the individual said to the government official, no, it's a go, because you're not going to be able to reel that one back in. And I think the lesson learned here is, because now the government's all over it. They understand it's working extremely well. It's providing safer workplaces. More importantly, it's giving confidence to the owner of the business that now they can actually manage their staff through the pandemic. And I think the lesson learned here is, you know, yeah, protocols and regulations and T's crossed and I's dotted are really important. But when you get down to it, action means results. And I think what we're seeing now is results.
Yeah. So one of the things, as part of that story, I think, to be fair to the provincial government, no provincial government up until about 10 days ago, wasn't it 10 days ago, Greg, just before we launched, announced that the Ontario government announced that this could be self-administered. And I think there was still some squawking around saying, geez, you know, before it needed to be a doctor or a nurse.
Yeah.
And once we did it, just before, like we did the screening, we tested before we went on Facebook Live so we didn't impale ourselves. But when we did it, I said a well-trained basset hound could do this test. It is so simple. And I think that's the magic of this, is these screening kits are very accurate. They're 90+%. There is some false positives or false negatives, but it's very effective. And it's good for screening, that if you're doing it every couple of days, you're not likely to miss people. But the simplicity of the test, that it can be done in the workplace before people start their shift. And the whole idea is, if somebody who doesn't feel sick, doesn't look sick, but they get a positive, take them out of the workplace. They then can go to public health, do their isolation, get a PCR test, which is the full meal deal, to get a confirmation. But you take that risk element out of your workplace. And so, you know, as Greg, when we launched that, I think on the Tuesday, we had 3,400 kits. We launched the website on Wednesday at 9 a.m. All 3,400 kits were spoken for by 10 a.m. And as you said, over 500 businesses, 50,000 kits. It's exploding. Maybe talk a little bit.
I think they realize, though, as you like to say, if Greg and Ian can do this, literally anybody can do this.
Absolutely. If Dumb and Dumber can do it, anybody can do this and do it safely. Look, there's two questions, because I don't want to miss these. Can daycares apply to get these? Greg, anybody that's in Region of Waterloo, business organization, can go to that chambercheck.ca and order these?
Yeah, well, the only problem is, you know, and I understand that the problem is we're getting some daycare situations that are really come under provincial government guidance, and they can be shipped directly to the daycare from the province. You need to get a hold of probably the Ministry of Health or the ministry that regulates daycares, and maybe even the Region of Waterloo for that matter, to see. The problem is we get some daycares or some schools saying they want to test students. This is not for, at this point anyway, not for broad testing. This is for specifically employees only. So, I think you should get some clarification on that in bringing.
I think the question is specifically for the employees of the daycare. So if it's, as long as it's not going to students or to the people in your care, I think that ask, but I think you can order those for the employees. Because you as the employer can then offer that to your employees. The other question was, how do you sign up for the kit? So this is where, back to Allison, maybe explain, and then I'll come back to you, because there's more to this rapid screening test. But when people go to chambercheck.ca, explain what they're going to see and how they can order or access the different programs.
So when you go to chambercheck.ca, you're going to, I think there's 4 or 5 kind of main boxes that you'll see. You'll see Chambercheck training, you'll see Ask the Expert, which we'll talk about in a minute. You'll see government programs, and you'll see screening kits and masks. And so if you're interested in screening kits and or masks, then you click on that button, then there's an order form that you fill out.
So it's very simple. It's basically going to give you how many employees you have. It'll give you 2 kits per employee per week. We're going to try and give, I think we're up to 2-week supply now, Greg, because we've got enough. We've got a 2-week supply. At the same time, we're going to talk about masks in a minute too. You'll get a supply of medical grade masks courtesy of Eclipse Automation at the same time. So it's very simple. Just go to, so the answer to your question, whoever it was, 1:22 p.m. in the chat box, go to chambercheck.ca, click that button, and the order form's right there. And then you'll be notified via email of when you can come by the Cambridge Chamber to do your pickup. So we do that safely, because you will have to watch about a 5-minute video, 6-minute video, and sign some paperwork, which is just the receipt of these kits. But it doesn't take long, and you'll be given. It's very seamless. When I was there unloading the masks the other day, Greg, there was a steady stream. People come in and they're in and out in 10, 12 minutes. So it's very convenient. Okay, back to the rapid screening, Greg. There's two sides to this, and the part we're doing is getting these kits directly to business, which is part of chambercheck.ca. There's another part of this, so I think we should highlight for people. If you're a small business that doesn't have a workplace, or you're a gig worker by yourself, or just a concerned citizen, there's this other part, Stay Safe program, which was just launched yesterday. And I think we should give some kudos to Ian Klugman and his gang for having got this community mobile bus rapid screening project up and running.
Yeah, interesting that you'd mentioned that, because actually, if anybody knows where the Cambridge Chamber of Commerce is, we're right at the southwest corner of 401 at Hespeler Road, and we have a large parking lot. And of course, trying to find a place to park a bus, which is the rapid bus program, screening program, was difficult. So they're actually in our parking lot today.
Are they really?
Yes, yeah. And it's kind of neat. You see employees coming in, and they might be before their shift. They've gone out onto the Thrive website, the Stay Safe website, arrange for a time to come and get screened. They come here. They go through a little bit of a training process. They go on the bus. There's actually little barriers there. They stand in between them. They do their own screen. They do their own test. They leave, and then they're contacted with the results of their test within about 15 or 20 minutes. So really a cool program. You'll see the buses around. They're wrapped kind of very colorfully, and they're marked up and saying what they are, and trying to promote keeping the community safe. And I think, from my perspective, and I think Ian Klugman, who really Communitech is kind of leading the charge with the rapid bus screening program, what they're hoping is this will expand and become a more community-wide opportunity for individuals to get screened. Because what we're finding, really is that these screens are really incredibly accurate. In fact, I also heard that Air Canada has done 14,000 screens in the last 2 weeks of their employees, and not one false positive or not one false negative. They've all been 100% correct. The other really good thing is there were only 14 positive results out of those 14,000, oddly enough, and all 14 did a PCR test, and they were confirmed to be positive. So these are really, really important. They're not going to be the standard, where public health is going to adopt them, because a PCR test is a deeper, more diagnostic type of test. We always refer to these rapid tests as akin to a pregnancy test. Really, that's kind of how they operate and how they work. But the fact of the matter is, we need to identify that. When I gave you that stat earlier, about a third are asymptomatic and 55% are contracting it from an asymptomatic carrier. No time more important than to identify and zero in on the asymptomatics.
Yeah. Another question came in, and then I'm going to move to masks because I think it's an important part of how we're marrying this together, which is great. But how does the reporting requirement work? And I think this is important in that we're giving these to a business, and there is some responsibility, but the reporting is, to describe the reporting, it's not personal information. It's you've got the kits, you've done the test, and then how many positives versus negatives, I think is not much more than that.
Yeah, so there's a little bit of a debate around this, and I'll get into that in a little bit. But basically, we have on the same Chambercheck.ca under the order form area. There's also a link in there for you, and it's required that if you're going to take these kits, you've got to go in and you've got to record your results after your screens. But what we're asking for is the business name, the individual contact, just so we can keep things consistent. We know who the supervisor is that's doing that. And then the number of positives, number of negatives, and number of inconclusives. Inconclusives is really, really important. It doesn't mean that you're probably not negative or not positive. It means that you're probably positive. It just can't conclude that for sure. So you really need to get a PCR test with that as well. But we need to know those numbers to validate the sensitivity of the whole program and how it's rolling out and how it's working. Now, the rules under provincial health laws are that the individual that actually screens is responsible to report the results. Well, since the province made the change to say that you can self-screen, that puts all of the responsibility on the individual employee. But let me tell you, I think we're going to probably find in the very end that there's going to have to be some sort of requirement. If an individual screens positive with these, they're more than just obligated to call public health. They must call public health and arrange for a PCR test within 24 hours. And I suspect that possibly the province may revisit that and say that it will be the employer's responsibility to call public health and identify the individual so that we can contain this. Because if an individual does not self-isolate after that and does not go in for a PCR test, we're no better off. We've got an individual out there that's positive who could potentially be spreading it around, and that's the idea of this.
And I think one of the pieces, though, and in answer to the question, is there is some responsibility for the business that has got the kits to report back how many have been done, and as Greg's described. I think the personal part is if someone's actually taking the screening test, you know, they got to know that they're going potentially taking home to their family, their parents, their kids, and their workers or their fellow workers. So we're on that sort of thing, but there is I think there's a sense of if you're doing the test in the first place, that you need to adhere to what it is and that you can self-isolate and get that PCR test very quickly. Doesn't mean you go for 2 weeks of isolation. It means go home, book the test, and either get a confirmation or because then you can get the public health treatment.
But yeah, as an employer, you don't want them in your workplace. If they tested positive with screening, you don't want them in your workplace. Otherwise, you're going to have 10 more the next day. So you want to get them out.
Just before we move on, I'm wondering, because you both have done the rapid test, whether you can describe the experience. We've heard the PCR tests. Those are the ones that are done at the assessment centers. They can be uncomfortable. Any discomfort with the rapid tests?
Oh, Ian was nervous. He was nervous.
I did, because Greg had done it, and he said, well, before we go on Facebook Live and impale ourselves and embarrass ourselves, let's do this. And he says, it's pretty simple. He walked me through it. So he was the dumb, I was the dumber as of that part of when we did it testing. The way I describe it is, it's like you jumped into a pool and got a little bit of water up your schnoz. You know that ticklish feeling when you got a little bit of water in your nose? That's it. It only, the swab goes up about, I mean, it's 2 centimeters, so it doesn't even really get up along the side of your nose, both sides. You put it into a tube with a little bit of antigen solution, and that's it. And then you swish it around and you put 5 drops in this little screening card or a plastic kit, and you're done. So it's not invasive at all. It's very, very quick. I think it's less than 15 minutes, but somewhere between 10 and 15 minutes from the time you walk into the room to the time you're done with your results. So it's very effective. It is very accurate, easy to do, and it's not invasive at all. I think if you have to go and get your PCR test, that's the one where you know, feels like they're drilling into the back of your brain. But this one is not, it tickles more than anything else. It's not invasive at all.
Yeah.
Greg, that your.
Yeah, it's kind of like putting, you take your little kids when they're little babies and you put a Q-tip in their nose and you clean their nose out. It's exactly the same as that. Yeah, it can give you a little tickly feeling, but there's no pain. It's not. Once you do it once, I can tell you, you have no problem doing it a second, a third, and a fourth time.
Okay, one question that I'm going to come back and we're going to start talking about masks is Jenny says, are you looking for places to house the buses? I think we're always open if there's a better location than the ones we're using. So if anybody out there in Chamberland or Business Success Series land has an idea, we're looking for central locations, but feed that into either Greg's email or mine, and we'll make sure we get that to Ian Klugman and his group, Leslie and Sarah and their gang that's organizing that one. Okay, I want to move to masks now, Greg, and this is kind of late develop. Actually, all of this is late developing, but as Allison alluded to, on the screening kits / masks tab, we've got now the capacity or the ability, and we are distributing free medical grade masks, circa like this one here from Eclipse Automation. These are ASTM level 3 masks. Eclipse Automation on, I think it was Monday, donated 1.5 million. That's an million masks through us and the business community and to the municipalities to distribute to businesses all across the region. One of the things we know, Greg, is the reason rapid screening is important is as we come out of this lockdown, we've got to have more tools so that we can identify those that are sick or have the COVID, so we can safely reopen businesses and stay open. The other thing is this, and I always like the story you tell about cloth masks, the efficiency and effectiveness of a cloth mask versus this. I think you said something like a 2-ply cloth mask is 10%. This mask here, if you put it on properly and put it against your nose, is north of 90% effective. And with these new variants, this is a critically important piece of, along with rapid testing, of what businesses can do to stay safe. Tell us about Eclipse, how they started this, the donation, and how we're going to distribute them. And certainly, there's going to be other ways, but we're going to do this through Chambercheck.
Well, Eclipse Automation is an incredible company here, and I remember just after I started with the Chamber, I got a phone call from him. He wanted to join. There were 3 escapees from ATS Automation that decided they would open their own automation tooling business. And I went and met them first in a very small little shop where most of it was just shop because it was very small, and the 3 of them were working away in there. Today, they have about 1,200 employees around the world with 3 different locations, one in Hungary, one in Arizona, and one in Charlotte, North Carolina, and of course here. They actually have 6 operations here in the region of Waterloo. So they're a massive, massive, massive company. And I can remember getting a call about 4 days after Doug Ford called for the first lockdown last March. And it was Steve Mai, the president and CEO of Eclipse Automation, and he said, Greg, just want to let you know, the premier's called on manufacturers to step up and start making PPE locally. He says it is ridiculous that we don't manufacture PPE. So he says, I'm going to make the N95 masks. And he threw some ridiculous amount of millions of dollars of his own money in behind this to stand this up, and has full production of N95 masks as well as level 3 ASTM medical grade surgical masks. And oddly enough, business is business. He's sold the line for his ASTM medical grade mask, although he says, I can't tell you who, but it's a local sale. So they're still Canadian made, going to be Canadian made masks, because really that's his business. His business is he designs and builds automated lines and then sells. Right, and so that's exactly what he did with this. So this, and Steve is a great guy. We've had him on our show a couple of times. They're a phenomenal mask, and I'll tell you, that's right. Ian is exactly right. These are the next step up for these is an N95 respirator. So these are about 93. These are, I guess, considered in the industry N93s. the efficacy of even a 3-ply mask with a filter in it is about 38%.
That's with a filter. You have to have a filter.
That's with a filter in it. And the reason is, as Steve pointed out to us, is the way masks are manufactured and the way they're layered. And then what a lot of people don't know is these ones, the level 3 ones, have a little static charge in them. You don't feel it, you don't get a shock from it, but it's got enough of a static charge that when the virus enters, because you can't make the hole small enough, it bounces back and forth in there because it's trying to find its way through the weave, and the little magnetic charge in there attracts the virus, and that's really what it is. But here's where the big issue is. I said to Steve, I said, you know, they're very thin, and Ian will attest to it. It's almost like a couple of pieces of tissue paper in your hand. It's not much thicker. Yeah. And I said, you know, but I said to Steve, but Steve, you can breathe so easily through these. They don't feel like they're offering me more protection. And he said, well, Greg, we have to do that because the people that have to wear these have to wear them for 12 straight consecutive hours. And they have to work while they're doing that. So they need to be breathable. So when we came out back in February and said to the province, don't open up the province until you've got new measures, because the last ones didn't work, by the way. That's why we were in a lockdown. And we recommended wearing ASTM medical grade masks. We did that because of the information that we had acquired from people that actually make this stuff. And say we make them breathable because that's who we're making them for, and we make them effective because that's who we're making them for. And if you look at Doug Ford or any of the health experts, when they're out walking around and in public, they're wearing an ASTM level 3 medical grade mask. So if it's good enough for them, it's got to be good enough for us. And we just don't see any rationale why it's not compulsory in the workplace.
So one of the things that, because some fights we're not going to win in the short term, but Steve made available to us and donated to the community and to business 1.5 million. We hand bombed at your office, I think it was 100,000 masks, because we're going to pair it together with the rapid screening. So free of charge, and you don't, even if you're not doing the rapid screening, which we encourage, but you don't have to, you can order the masks on their own. And we want to get these out to every employer and say, you should be saying to your staff, your family, your staff, and customers, if they're going to be congregating for long periods of time, that these are the masks that you want them to wear in the workplace. And the government of Quebec, Greg, just did that last week. They've mandated these types of masks in all work settings. Whether the province does it or not, we've got 1.5 million of these things. We want to give them out and make them available to business. So that's a big, I mean, those are the two things that are, that doesn't cost a business anything. So the rapid screening kits, $10 a piece, more or less. So if you come and get a week's supply or 2 weeks supply of testing kits and masks, you're probably getting $500 to $600 worth of PPE and screening free of charge. And so if it's free, we encourage you to come down and take advantage of these masks, because those two things alone will be new tools that as we come out of this latest lockdown, where we can open safely and stay open. And I think that's really the important part of this. So we want people to spread the message and get this out to everyone across the community, that these free resources are there. And great partnership from Eclipse Automation. Tony Lamantia from Waterloo Active helped us make that happen. But it's a great opportunity to have new tools for business so we can stay open.
Yeah, for sure. It's so important. You know, we're so close. We see the light at the end of the tunnel is getting brighter and brighter every day as more vaccinations happen. You know, but we're not there, and we need to fight really, really hard here. You know, when you listen to all of the data that's out there now, it's just not making sense that whether you're vaccinated or not, whether you're sick of this or not, that you're not putting in every ounce of effort you possibly can to keep people from getting ill, because we see the numbers every single day. They're out of control. The variants are, by the way, the rapid screening kits that we offer do detect the B117, the UK variant. We're in the worst part. We're actually in the worst part right now.
Yeah.
Because,
we are.
Only because we know the end is near, and everybody's getting confident. Oh, I'm going to get my vaccine. Everything's going to be okay. Yeah, it's going to be okay, but we're still paddling upstream, and we got to paddle harder, and we got to be smarter.
Okay, I'm going to go to Allison because there's two other things we want to highlight that are in Chambercheck, which I think are really important. And then again, to your point, Greg, we can see the end of the light at the end of the tunnel, but it's still a fair ways off. Two things, Allison, that I wanted to ask the expert program, which is really our thing of Greg and I, every couple of weeks or so, every 3 weeks, get on and talk about with experts, usually from the accounting field, but our experts in the government funding programs. And again, there's provincial funding programs for cash flow support, there's federal programs, and that Ask the Expert session allows people that have questions that are having trouble navigating through. So tell us about Ask the Expert and the resource that's there in that button where it talks about the government support programs.
Yeah, thanks. So we launched, our two chambers launched Ask the Expert in January because we were both chambers were hearing from businesses that were really struggling with navigating the government financial support that was out there. And often small businesses just don't have access to the expertise resources in order to help them navigate through the applications. And so we launched Ask the Expert. Initially, we were doing it twice a week because there were lots of questions out there. We're now running it once a month, so it's the second Thursday of every month. And basically, it's a live Q&A, and we have an expert on, like Ian said, from an accounting firm. There's no presentation. It's just an opportunity for businesses to come on. They can ask questions when they register, or they can ask questions during the actual call. And if they have specific questions, the expert is there to answer their questions or provide some kind of guidance to help them navigate and hopefully secure some funding. On Chambercheck.ca, we also do outline the types of government funding programs that are available. So there's about 8 or 9 of them. One of the government funding programs, the Ontario Small Business Support, the application closed for that last week, but the rest of the applications are for the most part still open. So we do have a summary about those programs available, and we do have one-pagers available in different languages as well.
And I think that's important. You can get the information and say, oh, that program might be a fit, might not. Our advice, and because Greg and I host that, are the two of us with, and a lot of times we have questions that have come up during the previous couple of weeks where we're hearing individually from folks. So we bring that and put that right to our experts and then record it and make that available for folks to go on the website in case they missed it. But I think what's important there is, Greg, on those programs, is the importance of applying, because there, you never know whether you're going to get support, but this is the crunch time for especially small and medium-sized business to make sure they get through to if you've made it this far, we want you to make it through to the end when things start to pick up. And so getting these, applying for as many of these as you might fit is really important, so you can get that cash flow support.
Yeah, and I think that, that's kind of the key. There's a lot of them that have maybe looked at the forms online and said, that's too complex, or I don't understand that. And we've helped individuals connect with experts to get just the right amount of advice so that they could go ahead and pursue it themselves. But, I don't know how many times we said it, Ian, just apply, just apply. If you get turned down, you get turned down. We'll try and help you, but if you don't apply, you don't know. And we've had more people find out that they do qualify by applying alone.
Yeah. Okay. One thing that's upcoming, and this is one of those reasons to pay attention and keep going back to chambercheck.ca. The region and FedDev are starting a new program, which, for lack of a better term, is an ambassador program where we'll be having, people available to come into a business. So I would almost say it's the companion piece to the Exonified Chamber Business Ready, where if you want to do it online, you can do that. If you want someone to come in and kind of walk you through the process, we'll have some live bodies, and it's called the, I guess it's the region's NSF Ambassador Program. It's not live yet, but it's coming. But we will be promoting that and making that information available on how to access that. But again, that's a way that we're adding new things to chambercheck.ca. Allison, maybe just a little bit about I know we don't have all the details, but generally what it is, and for people to stay tuned for it.
Yeah, so the region announced a couple weeks ago now that they're hopefully going to be launching the COVID Safe Ambassador Program in early May. It's going to be a free program. It's voluntary for businesses. So if businesses are interested in having someone come in to do some education and some resources and to look at what you're doing as a business to ensure that you're operating safely, then that resource will be there available.
And so I mean, that'll be something that we'll do on Ask the Expert, and we'll be promoting through both chambers and through this field when it comes up. But another example of, as resources become available, we're going to be promoting them and pushing them out. Okay, 2 questions, and I think these are more for Greg, and then we'll try and, we got about 10 minutes, so we'll see if there's any more questions and then wrap up. Greg, there was a question around, do the kits, so the testing kits expire? And I don't think they do. But do you have any line of sight on, I don't think there's any issue with these kits expiring before you use them.
Well, it's kind of like buying milk. You know, you look at the expiry date and lots of people won't drink it like the day after, but I can assure you the expiry date, there's nothing magic about an expiry date. But everything, especially in the medical field, does have to have one. These ones are actually about a year. So I think they expire in 2022 sometime. But you know, if they're unsealed, there's nothing in the package that would necessarily expire. The buffering agent is simply an activator, and it's in a sealed, you know, plastic kind of bottle. It's not going to go bad until it's opened, and I assume it would. But you know, you got lots and lots of time.
Yeah, lots of time, and they won't give them out to us. They won't ship them to us to give to you if they're expired.
No, I think what's important to understand about these, and you know, we sense a little bit of panic, like how long will this be going on? The federal government has committed to us, actually as late as this morning, not to worry about supply. There's an abundance of supply. There's almost 50 million, 50 million of these available. And as that supply starts to deplete, they're going to backfill it with more and more and more and more. They feel that we're going to need to do this for about another year.
Okay, question on the masks, Greg, and I think it's just how many masks can they get at a time? And I think what we would do is, based on your employee count, we're gonna, you know, I think it would be roughly the same.
If you have 50 employees, we'll probably give you, you know, 100 or 150 masks, something like that.
And you can come back every couple of weeks. So we're trying to match it together with what we would do for the testing kits. So, but I think the thing is, get some, make sure your staff try them. They'll find that they're much more comfortable. You'll feel more comfortable, and we'll give as many as we can. But it's a wise investment, and certainly we can be the ones to help you test drive it to make sure you're okay. Okay, there's a question here, and I think I know the answer to this, but it's talking about the Chamber Business Ready certification, and the business owner has to do it to get the decal, and saying, look, it's the head of people and culture, so basically a VP. It's someone in management that needs to take this. It doesn't have to be the CEO. It needs to be someone in management that takes that course. And then there's also an employee stream. Is that right, Allison?
Yeah, so business owner, operator, or a designate. So somebody that has some responsibility or oversight over the operations that would be able to implement the safe practices is fine.
Okay, so again, chambercheck.ca. Okay, we got about 5 minutes left. I'm wondering if we forgot anything, but I think that actually covers most of what we had. Maybe the thing, maybe we'll Greg, just finishing up on the rapid screening and the fact that this pilot, I mean, we're doing innovative stuff through chambercheck.ca as 2 chambers, but this rapid screening pilot that we're doing, you know, maybe talk about, you're gonna put a how-to manual together. We're probably gonna have, with the video, where to access the kits for chambers. We're going to make sure there's others that might do it too, but through the chamber network, we hope to have this up and running in all corners of the province within week to 10 days, or 10 days to 2 weeks, right? That they'll be available widely. And so we want people to spread the news. If you've got friends and colleagues in other parts of the province, tell them about it. Tell them to ask their chamber whether they're involved in this program, and get the word of mouth going, because this is, I'm sure this is something that will resonate everywhere. But we're making this available to our colleagues in other chambers across the province because we know how important this is.
Well, I think Research in Motion said that all good ideas start in the region of Waterloo, and you know, they kind of started us down that path, but maybe not. Maybe it was Elector Home way back that said all good ideas start right here in the region of Waterloo. And as Ian will attest to, he received phone calls from right across the country. I received phone calls from across the country. You know, and because we believe it's important, and we are, believe me, we're having to drag government down the path with us. Like, they're not the ones out in front of this. We're pulling them down the path and saying, just get this out the door, get this out the door. You've got a reliable network, which is this chamber network, to deliver these things and to deliver on the promises. And yeah, I think, you know, in a couple of weeks, maybe in a few weeks, this will be right across the country as the provinces kind of align their rules and regulations around it. And we can look back and say, well, of course, in the region of Waterloo, we know more and we're faster and we're smarter than everybody else.
Okay, one more question's come in, and this is an important one, and I'm not sure we covered it. Are organizations making this optional and mandatory for their employees? And the answer is you cannot obligate an employee to take this. You can encourage and say you'd like them to do it. If someone says no, you have no right to ask them to do it. Maybe Greg or Allison can take that one, but I mean, if someone's going to say no, they're going to say no. I think most people will. I mean, my philosophy would be, I hope you take it, because I would think you'd want your kids and your wife and your husband and your parents to know whether you've got it, because you don't want to get them sick. But it's not something you can obligate an employee to do. Is that right?
Yeah. There's one way you can make it mandatory. If you're working remotely now, if your office is working remotely and people are saying, I want to go work in the office, you say, no problem. You got a screen before you come in the office.
Yeah.
And you know, you can certainly do that you have two options. You can work from home, or if you want to come into the office and work, you're going to have to do the screen.
Yeah. But if you take them into the workplace and people are already coming in, you cannot obligate them. But you know, we'll see.
You know what happened? You know what's happened in a couple of the workplaces though is the vast majority have said, yeah, I want to know.
Yeah.
You know, for the protection of their own family as well, right? And they say, yeah, I want to know. Well, when the majority of employees are lined up there to get their screen, you know, they're yelling, they're yelling at Joe, hey Joe, get over here, get your swab out. And so I think there's peer pressure.
Okay, I think we're going to leave it there. Maybe just I'll give you each, Allison, any reminders or last thoughts for the group before we end things?
Just that all the programs that we're offering here are free, and they are open to chamber members and non-members, and all the information you can find is on chambercheck.ca.
I knew, that's what I was asking for there, Chambercheck. Gregory, any parting thoughts?
Just the same thought as Rocco Rossi would leave you with: stay positive and test negative.
Yeah, I love that. Okay, thank you so much to Allison and Greg. That does bring us to the end of today's session. Thank you again to our title sponsor, Manulife, our platinum sponsor for the series, the Immigration Partnership of Waterloo Region. This month's presenting sponsor, Learners LLP. Finally, for all of you for joining us today, as a reminder, we do host a new business success series every Wednesday at 1 o'clock. Next week, Devin Franklin from World Education Services joins us to discuss a new pilot project underway in the region to activate local businesses and design solutions addressed at aiming to end barriers businesses face when tapping into immigrant talent, which is an important source of talent for our communities. Hope to see you then. For more details, go to greaterkwchamber.com. We do encourage you to share with your colleagues and friends this series. There's lots of great information that's important to business. Please, and do join us next Wednesday for another edition of the Business Success Series, because if it's Wednesday, it's the Business Success Series. Thanks so much, everyone. Have a great afternoon.